How are you?
My name is Lita Newstetter, and I am the owner of Metamorphosis Performing Arts Studio.
So, Lita, tell me what healthcare you had before the ACA went into effect.
Well, I did not have any health insurance before that went into effect. I used to work full-time for the county and for other youth and family centers, and I had insurance then, but when I went into business for myself, that wasn't something I could afford. So for the past 6 years, I haven't had insurance, and it was kind of a choice between pursuing my dream and wanting to do what I do, but not have insurance, or give up my dream and go back and work for somebody else in order to have insurance again.
And what did that mean for you? How did that feel not having that afforded you?
Well, I just, luckily I'm a really healthy person and I take care of myself, but I was in the constant strain of knowing that if anything were to happen to me, it would completely wipe me out. I'm a struggling artist, educator, trying to make a living. I don't have a big nest egg of money, and even a trip to the hospital that would have completely put me, I wouldn't have been able to pay my rent if that had happened, and I like to run, and that's a good thing, but I had a friend of mine who broke her ankle and had to spend a couple days in the hospital and then couldn't work. She couldn't stand up for several weeks, and I just thought, if that happened to me, my business would go under, because I wouldn't be able to pay for that. It's just constantly worrying about things like that. What if when I'm loading my equipment down the stairs, I trip? I'll be sunk. I'll be done. Illness. It was always on my mind that choosing to live this lifestyle and choosing to try to pursue this dream was meaning that I was putting myself at risk every day for some little thing that would happen that would have a catastrophic effect on me and my business.
So the fact that you do have access now and you have recently been able to get health insurance, how does that feel?
It's a weight lifted. I haven't rushed to make an appointment, but this is going to sound kind of cheesy, but it's like it hasn't really sunk in because it's been so many years. That the other day I found myself thinking, I should talk to the doctor about that pain I have had and my knee forever. And it's almost like, oh yeah, I can do that now. I can afford a copay. I can do that. I could actually call the doctor's office, and I'm one of the insured people now. I remember years and years and years ago when I tried to make an appointment with the woman that I would see, the nurse practitioner, and this was after I quit my job and didn't have insurance anymore, and they wouldn't even schedule the appointment. I thought maybe it would just be super expensive, but when I said I don't have insurance anymore, she's like, "Oh, I'm sorry, we can't make an appointment if you don't have insurance." And that, it was just such a shocker. It was like, I can't continue to go to the same person that I've built this relationship with for, like 15 years I'd been seeing this person, and all of a sudden it was no longer, I had to go find somebody else. So things like that, it's just all of a sudden this whole new world has opened up where I could actually go take care of myself now. Whoa, what? So I haven't actually done anything yet because like I said, it still hasn't sunk in. I'm one of the insured.
So, there are a lot of skeptics about this plan. What would you say to people who have been resistant to this kind of coverage being offered to folks?
Well, I'm not an expert, and I have friends that have said that because of this plan now they can't get insured, or their insurance is more than it was, and maybe that's true for them. Everybody has different needs, and I don't know how that all works out. I know for myself, it worked. I went from absolutely not being able to have insurance to absolutely having insurance, and so for people like me, it meant 0 to 100. And the plan is something I can afford. It's not going to break my bank. I can make those monthly payments. And for me, that's more motivation to actually stay healthier and take care of myself better. And I think there's a lot of people out there who, since they don't have insurance, it's just you feel hopeless, and then it's kind of makes you feel like, oh, well, why bother? Because I can't afford to, go to a doctor anyway. So for the people who are skeptical, I would say there's millions of people like me who absolutely couldn't have afforded insurance without this. And maybe there's some people that this isn't going to work as well for, but there's millions of us that it changes our lives, it transforms our lives. and other people aren't going to be stuck paying our bill if something happens to us. You know, we'll be able to handle it. So I think the pros are far outweighing the cons. You know, I think people have been really eager to pick it apart and find flaws in it just because of the bigger political issues and the idea that they don't want somebody telling them what to do. And I think there's honestly some kind of emotional immaturity about some of the reasons why people are criticizing it that don't actually have to do with whether or not it's helping them or not. You know, it's more just something they want to fight against. But I'm here to say, you know, for this person whose mission is to be transforming children's lives through the arts, which is not a high-paying career, you know, it's completely made all the difference for me. So
Thank you for sharing your story.
you're welcome.